Lori Menard, Clinical Director at the Pembroke Regional Hospital.
I'm a member of the Emergency Preparedness Committee.
Hi, I'm Scott Coombs, Vice President, Corporate and Support Services and the CFO here at Pembroke Regional Hospital.
At Command Center, managers brought forward challenges faced by frontline staff. This allowed us to collaborate and develop mitigation strategies to ensure that we were providing safe patient care.
I was really impressed and felt supported by the whole management team, really exemplifying all values at Pembroke Regional Hospital, but specifically the collaboration and commitment that was required to get through this code gray with as little impact to patient care in the community as possible, I think is something we should all be proud of.
Lessons were learned throughout the process. Policies will need to be adapted and more training to ensure that should this event happen again, we are even more prepared. The Pembroke Regional Hospital leadership team, in particular the IT team, took swift strategic action. The Pembroke Regional Hospital frontline staff were courageous and as well took swift action to ensure that patient safety was the key. You held this hospital together during a crisis.
I would like to celebrate our IT team's brilliant contributions in ensuring that this code gray was resolved in a timely manner.
Hi, I'm Grace. I'm the manager of the inpatient pharmacy.
Hi, I'm Josie Curry. I'm speaking to you from the 5th floor of the Pembroke Regional Hospital.
I'm very grateful and appreciative of my staff stepping up, making sure the shifts were covered, either extending their shifts, but most importantly, having the department covered 24 hours a day to ensure patient and medication safety was at the forefront.
Room 518 became the hub of our medical records code gray recovery team. This necessitated the computer shutdown protocol process, and we reverted to manual registrations hospital-wide. Yes, it was back to pen and paper.
Well, the hardest part, I guess, was the recovery. It took us probably for every hour we were down, probably about 6 hours on average to come back with all the detail that needed to be put back into the system to complete the patient's records.
The medical records recovery team were faced with the formidable task of entering every manual registration back into the system. The team was up for the challenge.
I have to give it to the team. They persevered. And they basically were patient in all aspects of this recovery and the overall downtime. So they just needed to make sure that everything was back so that patient care continued.
So we, the physicians, we acted quickly, and this was to ensure that patient care and safety was uninterrupted. We adopted a direct face-to-face as well as telephone communication, and this was to ensure that critical information and results were relayed in a timely manner.
I'm proud to say that in less than 48 hours, we were able to enter all manual registrations. Team members canceled their vacation, extended their shifts. We were prepared to do whatever we had to do to get the job done.
Through everyone's extra hours put in and our collaboration with the Ottawa Hospital, we were able to contain this threat, ensure no patient data was breached, and get our hospital back to normal operations in a very timely fashion.
I created a sign-up sheet for people to sign up for these extra shifts, and in no time at all, the sheet was completed and we had staff filling the standby positions.
So I think the other thing to comment on is how the team collaborated together right from the beginning of the collections from the floors right through to analyzing and reporting all these back in a timely manner. I think it worked out very well, and they did an excellent job in keeping their calm.
Physicians, we coordinated closely with our nursing colleagues, and the allied health professionals and the administrative staff, whereby priorities were laid out clearly and those safe handovers.
I could not have more appreciation for the great amount of effort that everyone put in. Thank you very much.
I can't thank the entire team enough for coming in clutch.
I'd just like to thank my fabulous lab team.
I am very grateful for our team.
Thank you to our IT team for their brilliant response to our code gray.
This Code Grey certainly put us to the test, and we came together as a hospital family to manage through this. Our values came to action. Everybody did an incredibly great job. Thank you so much. Really, we did this together. Together we care.